All right, I think we can get started. Welcome everyone to the last session. It is my pleasure to introduce physician assistant, also PA students from Augsburg University, Ryan and Madie. They will be speaking on their PA journey and any insights they have gained throughout that, but also like exploring what a PA career may look like. I also like to especially highlight that Ryan has his own pre-health podcast called Vitally Stable, which is ranked the fifth best Minnesota education podcast, woohoo, and the second best Minnesota medical podcast. So yay. And then I'll hand it off to both Madie and Ryan to introduce themselves.
Perfect. Thank you so much, Ting. We are really excited to be here. We'll make our intros here pretty short for you all, so we can just save as much time as we can for questions here. But Madie, I'll start now. You can go right on after me, okay? So for me, both me and Madie are actually the same class of Augsburg PA students. So we're both kind of most of the way through our rotations right now. We just finished our 7th rotation. So we're getting pretty close to official graduation. But for us, so both me and Matt are pursuing the Master's of Physician Assistant Studies. For me personally, I'm also pursuing a leadership certificate through Augsburg as well. So I'm kind of going through 2 programs at once. For all you Minnesota people that I was seeing in the chat, I did also graduate my undergrad from the University of Minnesota, Twin Cities. So I've been in Minnesota pretty much my whole life and done everything in Minnesota. My background is EMT, ED tech, the emergency medicine world, and I have a deep passion for helping people in the pre-health world. So thank you, Ting, for showing off my podcast. All of those recent achievements are like really new. That like happened all like a week and a half ago that I received all that. So pretty cool to get recognition, but I just love helping pre-health students in general. Obviously, my specialty is PA with the background that I have, but we help everything that we can through my pre-health platform. And then I also host a pre-PA mentorship group personally called The Pack, where I help people on more of a one-to-one basis, which funny enough, we're actually looking for openings for more people right now. So if you are actually truly pursuing PA or want a genuine mentor, someone to help you, we actually do have some spots open. So let me know. Madie, go for it.
All right. Hi, everyone. My name is Madie. I am lucky enough to be a co-classmate with Ryan. He's a great mentor and a great resource for you guys. I was asked to speak, and I'll just give a little background, but like you said, we'll want to leave this to you guys. So background, went to University of Wisconsin-La Crosse, majored in biology, minored in chemistry and psychology, and then took a gap year, worked as a EMT in Whitehall, Wisconsin, more of a rural medicine focus, and then worked as an ED tech in La Crosse. So kind of back where I started. But let's see. Yeah. So just currently a 2nd year student. I just finished up my pediatric rotation, and now I'm on to my last 2 electives. I got lucky, and I don't have any more core rotations required. So now I'm in a trauma surgical ICU rotation. So yeah, we'll kind of open up the floor to any questions, and feel free to, ask Ryan and I more about it, but we don't want to bore you unless you want to know. So
Awesome. Thank you so much, Ryan and Madie. I hear AMT representation coming
Yes, we
out.
do.
Yes.
Shout out to all you EMTs in the chat.
Yeah. So to start off is, I think one of the questions always start off is obviously why PA? Did you come into undergrad thinking you're doing PA? Did you explore other pre-health career paths and like the motivating factor of being PA?
What a wonderful question that we got asked in all of our interviews. Madie, I'll actually have you go first here if you want.
Sure. Yeah. So I entered undergrad not knowing exactly what I wanted to do, which I kind of found when people said that reassuring, because it's like, okay, I started off on a pre-med track, not necessarily like I wanted to do something in health. I was thinking about even biomedical sales, or, it was just kind of open. But I think what really swayed me was when I worked as an EMT in rural Wisconsin, PAs, they use a lot of PAs in those kind of critical access hospitals. And I think I was just really attracted to the profession in the sense of kind of the autonomy you could have, while also, having physician support. And then just that lateral mobility is kind of that buzzword that everyone likes to use. But I thought that was great because, I shadowed shadowed and worked with a PA that had worked in other specialties, which I thought was really neat. So emergency medicine wasn't his first career path. You can work in hematology and then go into emergency medicine. So I just thought that was really an attractive piece to me. And just all the PAs that I worked with were just outstanding humans. And I think they just really encouraged this track. I did see, I think it's, why not MD? I think is a really great question. And for me, I like that lateral mobility piece. I know that I had an interest in a few specialties. I know I wanted to remain general, but, I couldn't be in family medicine and in the emergency room and in internal medicine, So I think that part really helped kind of sway that decision. And then along with just personal, just preferences for family and just my partner. And I think that's kind of the main pieces. So just to summarize, that piece that I can move between specialties, the work-life family balance, and just kind of the outstanding humans that I had worked with, I think really encouraged me to pursue this path.
Yeah, I always love hearing Madie's story. That's why I had her go first. But for me, it was a very non-traditional pathway towards PA for me. So I actually started my college journey in business. I come from a very business-oriented family, and I thought I was going to run my own business in video production, and I thought that was the dream. That's what I wanted to do, and got halfway through undergrad, so about entering my junior year, and just realized it was not what I thought I wanted. It was just, I didn't like that world. I didn't like that for my life. Had a couple medical experiences happen around me. Witnessed a seizure close to me. I had my dad in the hospital for a little bit, and just realized I might have had more of a knack for the sciences that I never gave credit for. And actually started my medical journey being an EMT first. So like I didn't just switch everything to science right away. I wanted to see if I could do it as an EMT. At that time, I only heard about doctors and nurses, and that was my whole perception of what medicine was. So for a very short amount of my life, I was actually pre-DO. I liked the career path. I liked the route, but I didn't like a lot of the other components of the length of schooling, and there wasn't a DO school in Minnesota at the time, and there was a lot of challenges with that. And found out through my EMT team that PA was a career that I had never heard about, never been told about. And I did my own research and went, oh my gosh, this is everything that I've ever wanted, everything I've wanted to pursue. And that's actually when I switched my whole degree into sciences, still in the College of Liberal Arts at the U of M. So I didn't ever switch to the science college. I actually did an individualized degree through CLA at the time, and then told my advisor, I want to go to Augsburg. Oh, it's crazy to think back on that now, but it was this like targeted, I want to go to that school, and I could explain more of that later. But that was my top school at the time. And then just kind of kept falling in love with the career in every way that I could. So for me, it's more of an emotional journey. However, this is a very common question. Why PA? And a lot of people don't either know about PA or why PA is different than particularly nursing, or why would I choose it maybe over doctor? So I just wrote down a couple of like the most common answers you'll see, so that you can kind of pick the one. Obviously, Madie brought up a big word. Lateral mobility is probably one of the biggest, most commonly used words when it comes to the PA profession, because it's unique to our profession. We all are trained as generalists. We can move between our careers. So our burnout rate is one of the lowest amongst most medical specialties, because if we do get burnt out in a career, we can actually go somewhere else and try something new. So that can be a very valuable thing there. Work-life balance is a word that's very commonly used as well. A lot of PAs don't live in their career. They have the option to if they want, but a lot of them can have very much like a great career and work really high levels of medicine, but then also go home to a family or go home to another passion that they have. It's kind of a fun, cool component of that. On top of the fact, a lot of the doctors have a lot of these responsibilities they have to stay and they have to be present for. A lot of PAs, we get to work our day, work our shift, and then go home and then come back the next day and work. We can actually leave our work at work, which can be a very nice bonus of the PA profession. Another big thing, this is huge for me. So PA programs are 27 to 36 months. They are shorter programs. They're faster programs. We can enter our career faster. So for a lot of the people like me that I switched, I had to take extra semesters. I had to take summer classes. I had to take extra time and spend so much time out of school building what I didn't have. I didn't want to spend my whole life in school. So PA was a more logical pathway for me. So those are just a couple of things that we always tend to get brought up with the PA career. On top of it, it is one of the largest growing careers in all of medicine right now. It's pretty much been a top 5 medical career, honestly, a top 5 total career for like 5 to 6 years now. And it's still, the percentages are going up. It's growing. I just checked today. The Bureau of Labor Statistics has like salaries going up, job growth is going up, like everything's still going up. So just being a part of a growing career is also pretty wonderful. Those are probably the big points. I have other things if you want to go deeper into that. But those are probably usually the big things commonly mentioned.
No, that's amazing. Thank you, Ryan, for bringing up, and also Maddie for bringing up. I think a lot of the points you talk about are always concerns people have, and even in our other sessions, talking with other like professionals, work-life balance is a question that has come up once and once again. So for those of you, consider PA. Um, I both of you had extensive EMT experience, and one of our audience was wondering specifically, you don't have to share if you don't, which ambulance company did you work for? And they have their EMT basic, and I'm looking for suggestions about, yeah, it's just starting that EMT career. They also wanted to work as a ED tech in the hospital, and how would you recommend going about this without having any clinical experience before? So.
Ooh,
People
okay.
questions.
Madie, I'll have you go first again if you want. I have an answer for it,
Sure.
but feel free to take it first.
I started in more of a rural spot, which I think, there's always shortages in medicine, but especially in rural medicine. So I think that really, I had a connection with a friend who was working as an EMTB out in rural Wisconsin. And he said, hey, we're always looking for spots or people to work. And I said, okay, great, let's do it. And I think that provides definitely a unique experience. And I think really you see the purpose of PAs, like they're really here to bridge that gap in a lot of this preventative medicine and this more of the, not as close to primary care centers. But I would say just reach out to local rural ambulance spots. I think that's a good spot to start. I mean, if you know that you don't want to do that, it doesn't hurt to just kind of toss your application out there, send people your resume, just send it to a lot of people. If you only get one hit, you still got, one response back. But I think that really helped me get into it because I know a lot of EMT services want you to have X amount of experience, X amount of years as served as an EMT. So I think some places are a little bit more willing to accept new EMTs. And then as in regards to, I guess I should say, I worked for Whitehall, Wisconsin. It was called Tri-County Ambulance Service. So I'm sure they're always looking for more EMTs. And I have a connection, so reach out to me after and we can talk. And then in regards to ED Tech, I would say that's another thing. So I was looking in the cities. I had my EMT. I had graduated college. I was like, I want to, maybe I want to move back after college. And a lot of them required, 2 years of experience, X amount of years. So I think what really helped is I was working within that healthcare system. Gunderson serves it serves La Crosse and it serves a lot of rural medicine spaces in Wisconsin. So I think through that connection, by working at more of an outlying facility, I was able to, kind of put my resume in and put my application in. And they said, oh, wow, she's put in the time in this rural setting. And now, let's kind of bring her in. Let's talk to her. And I think it just kind of helped that I had worked as an EMT beforehand, but I don't think it's impossible by any means to start as an ED tech. But Ryan might have a few more thoughts because he has more of that urban experience, which I think is helpful.
Yes. So mine was primarily urban. So I didn't do almost any of the rural of my EMT care. And unfortunately, in the urban world, especially in big medical system urban worlds like Minnesota is for us, there is this horrible kind of aspect of EMT where it's very hard to get the job you think you want to get, like right out of certification. First of all, if you're in rural, do exactly what Madie said. That's exactly what I would recommend. Like reach out to local places. You never know who actually has an opening in rural spots because they just don't have the same load of people that are there to help. When it comes to urban, unfortunately, patient care is incredibly needed for PA, and EMT is one of the best ways to get it. So in our area, it's very competitive. It's going to be very challenging for you to find a nice paid comfortable EMT position right out of certification. It's just, I a lot of people, I used to train EMT classes and I would tell people like try, but don't be shocked if you don't get something right away. What I strongly recommend though, is a lot of times in the urban place, you have all these sporting events, you have all these events that are around. I would recommend event care. Okay. A lot of people think ambulance care. They think 911. That's great. You'll get there. You'll get your time there, but you might be applying for a year with no response if you go that route in the urban world. Whereas you might be able to apply to like an event-based team. I know for us, like the Twins have an event team, the Vikings have an event team. Like you can apply and use your EMT certification to go there, get your base event care experience, and then use that to apply to a 911 service or something like that. So that's a way I would do it. I was certified and trained and did all my work through the University of Minnesota Emergency Medical Services. So that is actually what I did. I worked event-based care and then grew that into a career path there. But a lot of times those event groups or those groups that work through universities, a lot of times they'll hire people in with no experience. Obviously, a lot of them are volunteer. So you're not going to get that pay, which unfortunately is a downside. But they'll at least give you that 6 months to a year of experience so that you can actually then go apply to the position you want. That would be where I would start. And unfortunately, this is going to be the same thing that's going to exist in the ED tech world when it comes to big hospital systems. They want experience. Honestly, they're sometimes harsher with their experience than the EMT kind of more 911 services. They really want people to have sometimes up over a year of experience before they put people into a tech position. Doesn't mean you can't get it. I've definitely seen people that get it, but most people, the pathway we work is like, let's get you your certification. Let's get you like a volunteer position for a little bit. Let's get you onto a rig, and then we'll go ED tech after that. That's usually the pathway that we end up going. So if you're applying right to ED tech right away, you're probably going to have some difficulty because a lot of people are doing that pathway, and you're always going to kind of be on the lower end of the totem pole. But you got to be comfortable as an EMT, maybe not getting that job you want right away, and just reaching out to people around you and see who will give you that first shot. I did a little bit of youth sports care. I mean, it was more like emergency responder early on. So I didn't really use my EMT, but I was covering youth sporting events. And that's a lot of times how I got my first experience to get a lot of the stuff that I had. So be patient, biggest thing I have. And if this is something that really like you've been struggling with this is actually a specialty of mine. Most of my mentees I work with are EMTs, and we do this. So feel free to like reach out to me separately, and I will tell you what might be best for your region or what area you might be able to reach out to. So please let me know.
That's amazing. No, I love the perspective, both rural and urban, to expand that option. Especially I come from I'm in Fresno, which is considered a more rural area, the Central Valley. So it's really nice to hear the perspective also from Madie, and then hearing more of the urban perspective. And so since PA school is a lot shorter, I think there's not a lot of knowledge from our audience of how that works. So I think I'm going to combine these two questions into one. Like, do PAs have board exams? How does the coursework kind of in PA look different than like undergrad? Or it's just like questions about that program. Yeah.
Absolutely. Let's keep the trend going. Madie, you want to go first?
Sure. Sounds good. I think that's a really good question. It is confusing. How do you get there? How are you equipped after a shorter amount of period of time? And I think, let's see, I would say so undergrad, we do the same classes as our pre-medicine, pre-MD, pre-DO colleagues. And I think kind of where it deviates is what Ryan was mentioning a little bit before. We have a lot of hours of clinical experience. So I think I had about 2,000 entering in, and that's kind of the average I know, which is, I think 2,000 is about a year full time. So I think that's one thing that kind of differs. And then in regards to PA school, so every PA school kind of differs, but kind of follows a general model. Is the first year or 12 to 15 months is what we call didactic year. And that's where we have our core classes. We have anatomy and physiology, we have clinical medicine, we have pharmacology, we have history and physical exam, kind of all that core components that medical school has. And one interesting thing about our program was we trained at the University of Minnesota Medical School, and we had cadavers, and we had a whole summer course. And it kind of exactly, we were talking to the anatomist that was working with us, and she goes, the only difference is they have maybe a couple more weeks than you do, a few more weeks. But she was like, I'm really not cutting too many things out for you guys. She was like, I just want to let you know, what you're doing is rigorous. So sometimes the misconception can be like, PA school is like easier. And it's like, not necessarily. No, we're training, we're expected to know, we have core, curriculum that we have to know, and we have, the same anatomy courses and stuff like that. And then after kind of that 12 to 15 month period, we go into clinical rotations, which is about 12 months. And then we have at Augsburg, we have 7 core rotations and 2 elective rotations. And kind of how we're tested throughout that is, say, for example, I was just on my pediatric rotation. They have kind of our governing body, or kind of one of the education bodies, PAEA, writes out kind of, hey, you should know these general diagnoses and all the ins and outs of these. And then we're going to put a standardized test together, and we're going to test you to make sure you can pass these benchmarks. So that'll look like, 7 of those tests. And then I have 2 electives. And then after that, we do have board examinations. So this summer, Ryan and I get the pleasure of taking our board exam. I signed up in August. I'm not sure. I think Ryan's in September. Yep. So that's about a 5.5 hour exam.
Yep.
And I think I'm not exactly sure how many questions was it. Yeah, we'll let Ryan take it from there.
I think it's
But
like 240 to 300. It's got to
yeah,
be in that range, I think.
yeah, definitely, definitely. But those are really good questions. I'm glad that, inquiring what it looks like throughout our course year, and I can be a little bit more in depth if kind of more questions were to arise. But I'll hand it over to Ryan.
Yeah, you got most of the actual specifics. I'll just kind of go over a general gist to make it like easier. So PA schools are different. They're a little different when it comes to like med schools. There's a very regimented like system. They do that kind of all of them are pretty much the same, but they have their regions they care about. With PA school, like we actually will have different like lengths of programs depending on what schools you're applying to. So your shortest program is going to be 24 months. Your longest program, I think these days is like 36 months. So like there will be some programs that'll have you train for their like extra year, depending on where you go to. So they are a little different. There's some variation. But the best way to describe it is keep in mind, PA students, we had to have patient care experience before we go in. Like that's a requirement for most of us. And Madie had 2000, which is for Augsburg. That's the minimum because our Augsburg values patient care hours more than some other things. So they want us higher. For me, I was up in the 4,000, 5,000 range. So like, it does range. The average PA student that makes a PA program these days is around the 4,000 to 5,000 range. I'll tell you that. Madie's just exceptional. That's why she's able to make it with much less. But like, I want you to be prepared. Most PA schools kind of want you to spend 2 years out of school getting patient care hours before you even apply. That's just kind of the average is what they're showing. But I say that to say that statement of is PA school harder or easier? It's kind of, it's a hard thing to say because it's not that it's any easier or harder. It's just faster. We don't go as deep as the doctors do. Like they go way deeper. They learn way more complicated, like physiology and stuff that we don't do, but we learn it at like half the time that they do. So it's like what is your hard? What do you define as what's hard for you? If you're a person that wants more time to do things, you might find PA school harder than med school because you might understand complex concepts, but you need more time. Whereas for us, like I think our whole musculoskeletal system was like a week and a half. Imagine learning like 300 bones in every muscle in the body and how they all function, like a week and a half and being tested on it. Like that is what PA school is for us. So that's the biggest difference I want to say. It's just fast. You'll hear every PA student say this. It's just, it comes at you and you kind of just survive it as you go. And then you figure it out when you get out into the world. That's kind of the feeling of PA school. But depends on you. I mean, for me, I can do that. I can survive that, but a lot of people would have a lot of trouble with the speed that we learn at. But we come out qualified in a different way. We come out qualified as generalists. None of us are going to be super specialists like the doctors are going to be, but we will be trained adequately for what we will be expected to do in our role.
Thank you.
And we can move. Sorry, just to
go.
say one more thing, and we can add fellowships are also something we can talk about later too, because I think that's a way we can specialize more, be more equipped in different capacities. But we can dive into that a little bit later. But that's one thing to talk about.
Yeah, awesome. No, we can definitely dive into fellowships. No, thank you, Ryan, Madie, for that, like really laying out the differences and like you said, being tested, like difficulty in different levels. It's like comparing apples to oranges. Can't really say, so the other. So, out of curiosity, what do you like now that you're in PA school and second year is about to take your board? Good luck on that. What did you wish you knew before starting PA school?
Feel free to go first, Madie, if you have something. Otherwise, I can go.
Sounds good. What I was thinking was, I have my fiance, his younger sister is doing an EMT course through high school. So I was like, and it's paid for. So she does not have to pay. Usually and Brian probably knows more of specifics, but I paid around $1,000 to do a certification. And then that's not including all the other miscellaneous expenses you have to pay for. But I would say one thing I wish I would have known is start patient care hours early. Even if it's only working 10 hours a week, it adds up a lot quicker. Because I had started EMS maybe my sophomore year of college, I want to say. And that was even considered late for PA because it's like, oh, people have been doing this forever who knew going into college they wanted to go to PA school. So I felt behind in regards to that. But then I took a gap year and was able to accumulate more. So I think that's one thing I would have liked to know. And I'll give it over to Ryan, but if I think of anything else, I'll kind of add that.
Yeah, unfortunately, when it comes to the cost of EMT certification, it's kind of gone up. I mean, you're looking at like the 1,800 to 2,000 now these days, depending on where you're training at. So it's just competitive. So they are allowed. The market has pushed up the price of that. So it's a little bit of a buy-in for EMT from a general thing. But when it comes to like what I wish I would have known, and this is something I tell my mentees all the time, which is like there was this big push in the like pre-health world to just do things to like just make a school, and there was a lot less emphasis on doing things you actually valued from. Like, and I feel like I did pretty well at this, even not knowing this, but like I wish that I had just had someone constantly reminding me, like, do the things that you value. Because I didn't think that like when I was in PA school, those things that I did, how much they would help me when time started to struggle. Like I was just talking about this yesterday with one of the class of 2025 at Augsburg. But we were talking about how our EMT backgrounds that we had made us exceptionally prepared for like clinical scenarios. So when we were in our like H&P class, we felt comfortable doing all these assessments because we had spent so much time doing that. And then for me, I spent an extra year doing ED tech and doing EKGs and doing that stuff. So I was ready for the cardiovascular system and reading EKGs. And now my next rotation is cardiology. So like that was a big thing that kind of changed the directory, like a trajectory of my life. So like I want people to know is don't just do things because it's recommended to make a school or make a program. Do things because you actually want to do them and you're going to gain value from them. I don't know many PA schools that if you like did something that like was in the medical world and you loved it, that they wouldn't see it as the same value as something else. Like it really, they want you to value from what you're doing and learn that you love medicine and you're developing a passion for medicine. That's what they care about. It's not just doing the things that is written on Reddit that other people did. So that's the biggest recommendation I give. And it's hard to do. It is really hard to do, especially when you don't make a program and you're like, I want to improve. I want to get better. I'm just going to do this thing that they say they like. Still, that's the most important time to even keep that in your brain.
Oh, thank you. Oh, I wasn't sure, Madie, you wanted to add on anything?
I don't think so. I think Ryan, that was a really great point to make, because PA schools and just any sort of admission body, if you do medical school too, people can understand when you're truly passionate about something and care about that, because that will really shape kind of everything moving forward. So I think that being authentic and genuine and just finding that passion, even if it looks like, you being an EMT and then being an MA, just kind of finding your niche, and just be gentle with yourself in it.
Awesome. No, like Alexia said, preach. I love developing hobbies and making sure that keeping you kind of sane during the intense process. And then zooming in into PA school is rigorous, just like any pre-health school. And so someone's asking about study habits and strategies. So how was your experience in developing a good study strategy in undergrad and then translating that to PA school?
I'll be going first again, Madie.
All right, sounds good. I would say for PA school, like Ryan was talking about, it's just a lot of information all at once, and you don't have time to always make flashcards for every single small thing on every presentation. So I think what changed was really kind of learning how to filter out what's important and what's not. And that doesn't feel good when someone tells you that when you're first starting school and you're like, how do I know what's important? But I would say what really helps is kind of the study habits that I had to change was leaning on people, work smarter, not harder. Like use other people's resources. People want to share. At least what I found from my PA experience is we're all on the same team. We're not competing against each other. So I would say kind of figuring out, who you study well with, along with finding your study tool. So I know some people use Anki, some people use Quizlet, but you will need to kind of that repetitive spaced repetition to really get that content from paper to kind of to solidify, and so you can use throughout that active year and clinical year, because you're always going to have to touch back on these things that we learned beginning. So I think that's what helped me a lot, was finding a study buddy and then finding my niche. So for me, Quizlet Plus worked really well, and we have a couple lovely classmates who made a lot of decks, and I just use those because I studied well with what they made, and I'm like, I don't necessarily need to recreate the wheel or whatever that saying is. I don't have to work harder there because she's already making these excellent things that cover all the points. But yeah, what about you, Ryan? What did you have to change or alter?
Yeah, I'll get to my 2 words here that I will say my biggest recommendation. But I first want to bring up a good point that Madie said. There's a unique thing in the PA world. It's not every PA school, but a lot of PA schools. I don't know. I'm not a genius when it comes to the pre-med and the medical school programs, but I know that there's like there was a thing about class rank and being competitive for residency and all that stuff exists in the medical school world. That does not exist as much in the PA world. Like what Madie said about we're all on the same team, that is so true in our class. Like we have 33 people all wanting all 33 of us to pass. There's no competition. There's not a strive for any of us to be the best in the class. We're just there trying to be great PAs together as a family. And I don't know if that's something that exists everywhere, but I want to make sure that you guys all know that's something at least we have experienced, which has been so wonderful. But when it comes to answering the question, I have two answers for it. My first statement is work in progress, because you'll never have a perfect method. There's going to be some time that you're going to think that your method's perfect and it's going to fall apart and you'll be like, oh my gosh, you have to adapt and adjust because it's a new unit. That was my story. Things I was doing in summer, they don't work now because, we jumped from like a 15 credit to like a 26 credit semester. So you kind of have to adapt. So just be open to adaptation is the biggest thing. Start with something, see if it works, but don't be afraid to drop it and try something completely new. Like that was the people that struggle were the ones that couldn't like leave what they used to do because it wasn't working. So like be ready to be able to adapt. But then the other thing I want to say is stop striving for perfection. And maybe this is a PA thing, but like for me, like it is so fast what we're learning. It is so quick that the people who would burn themselves out or struggle so much in our class were the ones who were trying to get 100%, because that's what we had to do as pre-health students. We had to get A's. We had to get all this stuff. It's not that we don't want to do that now. It's just that we don't need to pass our program. And there's so much more value in like having a good experience, staying energized and staying on pace than there is to getting 100%. Because at the end of the day, for us, we needed 80% on everything to pass. If you got an 80, it's not any different than getting 100. Like you don't get seen any different in your class for that. So for me, I was striving to get, okay, I just want to be close to maybe like 90. I don't need the A. I just need to know I know this stuff so I can be a qualified like provider one day. So that's the biggest thing I'll say is the tips I have is be adaptable and stop striving for perfection. Just strive to be as good as you can be.
No, I think that's like really good to address, because I think there is that perfection seeking, that type A with a lot of pre-health students coming out. So it's good to hear, like, especially from the other side, like that it's good to kind of give yourself some lax and know that it's a changing thing. It's not, there's nothing set in stone. Yeah. And then, so I'm actually really curious about this question too. So someone asked, as students, would you say one's career passion is more predetermined or something that's developed over time? Is it either better or worse if it's predetermined or versus if it's developed over time? Loaded question.
Wow.
Ooh,
Okay.
I like that
Do you have
question.
an
That's
answer for
fun.
that? I have an answer, but I want to give you a chance first.
Yeah, I was thinking through one. I would say there are definitely personalities that fit better with different specialties. So it kind of feels like a cop-out question to say a little bit of both. So maybe if I had to lean more towards one, I would say experiences. But I think there is a component of that predetermination, because like what my brain's thinking through is people in, I guess my only world that I know well is emergency medicine, and you kind of the humans you see in emergency medicine are a little bit adrenaline junkies. They like to move fast. They like to think quick, and I think that just doesn't fit everyone right out of the gates of PA school. And I don't know if even people have the capacity to do that in the same way that maybe someone who is very apt to do well in emergency medicine might not do as well in surgery. So I would say, but I think in the long run, you could really make it work in your experiences. Like, I think why I feel that way is because I've had so much experience as in the emergency world. And maybe that's why my brain was like, oh, I'm seeing a common theme of the personalities and the types of people that emergency medicine draws. But I think you can really choose whatever specialty if that's what you want in the end, just through your experiences. What do you think, Brian?
It's a deep question. So I think there's a component to this question where like our passions in life aren't just like, we don't just like walk into them. They're usually created through our sociological backgrounds, how we grew up, where we grew up, what we were grown up to think that was important in our lives. So like, I think there is a component to it that people might just be more naturally pushed towards certain things. But Kima, I just told you my story. I went into undergrad for my business family thinking I knew exactly what I wanted to do with my life and switched it halfway through undergrad. That doesn't make me less passionate about what I'm doing now. I actually sometimes argue people that have switched might sometimes be more passionate because they've fully confirmed that they didn't want to do the other thing. when it comes to this, the biggest thing, I don't know if there's a direct answer to the question, because I do think it's very person specific. But there is a big thing with passion. You can have a ton of passion for something and you can one day lose that passion. So passion is not this like set in stone thing. The biggest thing though is just make sure that the thing that you're passionate about is the thing that you're the most passionate about. So you need to take opportunities to try other things. You're not going to know if something else you like is something else you like unless you try it. You know, this is a big thing in the pre-health world. We get so set in stone with what we want to do. We get so set in stone with, I'm going to do this. No one's going to tell me I'm not going to do this. And we're all really, you wouldn't be pursuing this path if you weren't a successful person. So like, don't be afraid though to try something else one time. Okay. All of us go into every one of our rotations going like, I'm probably not going to like this one, but I'm going to give it every chance I have, because you never know. I might get this one person or I might get this one patient that'll change everything how I think about life, because it's a new experience I never had. So I think there's a part of it where I don't know if it is predetermined or it's gained. I don't know. I'm a living truth of that. I don't even know. But I do know that you can develop a passion in the journey. So you got to be open for that opportunity.
Yeah, no, that was a really interesting question. It's good to hear that there's not really a set answer, because it's kind of a combo of both, like, and like you said, a person specific. So we have two questions I think are all related to PA specialties. So specifically, how and when do PA, I think Madie touched a little bit on this, how and when do PA students choose their specialty, and do they have to do like a residency? So someone asked, if let's say you want to do be a PA in surgery, do you have to do like a residency, kind of like what an MD would do, or like I guess for a dental like oral surgeon they would have to do residency too. Yeah.
Okay.
Yeah,
Madie,
really
do
good
you have an answer?
questions.
Yeah.
Yeah, definitely. I would say so. I wonder which one I should answer. So when for the specialty, I'll just say, you know, when I come out, like Ryan was kind of touched on, we come out as generalists. You know, we're trained to pass kind of that primary care focused exam, and then I would say we can really go and apply to any specialty. I could go into urology. I could go into hematology. I think there are different things that can kind of maybe equip you in the sense of when we were talking residencies, but they're called fellowships in the PA world. And I think they have fellowships in surgery, they have fellowships in emergency medicine. Just they have additional opportunities where you're kind of treated like a resident and you have more time to get further training, further education, kind of curated for you as a new grad, which I think can be really, really beneficial in kind of making you a competitive applicant while also bringing confidence to you as a practicing clinician, especially, you know, if you were to be working in the emergency room in a critical care, critical access hospital. We want to have those additional skills and procedures, but also there's no harm or shame in coming out and, you know, choosing a specialty right away, because we do a lot of on the job training. I think that's a huge thing, kind of in any job, but all PA, well, I guess not all, but I think most new grad jobs have this onboarding period, and it's a little more extended being a new grad. So I think, you know, that's kind of what else did I miss, Ryan?
No, you pretty much hit on it. The biggest thing is the kind of the key piece to this is we're all trained as generalists. We certify as generalists. We don't pick a specialty in school. We don't actually really ever pick a specialty. We just might work in a field. So why I say that is there's kind of like, when it comes to fellowships for us, it's kind of an up and down thing. There's a lot of people that live by them, and there's a lot of people that really don't want to do them at all. And we don't have a requirement within our profession to do either. It kind of depends on where you want to go. So for me, I'm thinking more primary care. I'm thinking more family medicine. Keep in mind, we were trained as generalists. We were trained in the primary care world. So for me, there's a lot less push for me to go and pursue a fellowship, because it was based into the training that I had. And I feel quite comfortable with my background and experience and my PA school experience to be able to enter that and be successful. And I don't want to spend an extra year of my life where I've been waiting to make money. That'd be nice. But there's another part of that though, where if I were to go into internal medicine or go into surgery or go into trauma care, these big, very complex systems that obviously doctors spend so much time mastering, but we don't in PA school because they're more specialized, then there's a huge value in fellowships. So to kind of answer the question, it's not a needed thing. It's not a required thing. You don't have to go and do PA, and you'll have to do a fellowship to be a PA, but it's an option depending on where you want to go. But I would say answering the over question of when do PA people pick, again, another unique, it depends on the person. Some of us won't even know until we graduate and pass the pants, because you know what? We're going to look at the jobs available and we're going to go, well, that's the only one that's available in the region I want. And that's where we're going to go. And maybe then we develop a passion for it. So we don't have to choose. But I also know some people in our class that have been like, the day they walked in the door, they knew they were doing emergency medicine. And that's exactly where their first job is. So like some of us pick before we even start classes. But others of us, we don't have to ever pick. We just kind of go to what works in the life that we want to have.
Yeah, no, I think that like hits on the beauty of like being a PA, like having that flexibility, especially like notice like everyone comes in not sure and it's really difficult making a decision. So it's good to have that flexibility with being a PA. And now kind of going back to kind of like clinical hours, I know you both mentioned that thousands of hours, like really having that intensive patient care experience is really crucial for PA applications. So I guess the person is asking patient care technician, another clinical experience job. How do you keep track of the hours? And I think it can be expanded into how do you know you have enough hours that this is what I want to do, and then go into PA.
Great question. Madie, I'll have you go
That
first.
is a really good question. Okay, great. For me, Ryan might have a bit more experience working with mentees, but for me, I had an Excel sheet. I listed, this was a 12-hour shift, this was a 8-hour shift, and for me, one thing that I got a tip from someone, it said, put something that if there was anything, put something really cool that you saw that day. So you can kind of speak to it in interviews or in your personal statement. So that really helped me. But I think you should definitely keep track because, worst comes to worst, you just don't end up using that if you decide not to go into PA or you decide, a different track for you. But I think it's never too late to start early and to start tracking because I just think it'll make your life a lot easier if you're filling out the CASPA application, which is the PA version of, our application system, kind of a standardized application system. What do you think, Ryan?
Yeah, when it comes to keeping track, I mean, you could go old school and just keep a spreadsheet. That works great. But CASPA is not going to allow you to put it in by just numbers. What they're going to have you do is you're going to put like the amount of hours you worked a week and how many weeks you worked. So it's like if the way you want to keep track of it is just how much length of time you spent at a place and how many average hours you worked in a week. CASPA will do it for you, which is the nice part about it. So that can be a nice way to do it. But when it comes to answering like how do you know you have enough, keep in mind you're the two people in this session right now. Madie has had 2,000, which is by Augsburg standards, the minimum for what they look for. And I was up at 4,000, 5,000, a little over the average. So like that should be your tell to you that there isn't an exact amount. Again, PA schools are not like once you reach a certain level, then they don't care about the hours anymore. It's what you're gaining. It's the experience that you're gaining and the stuff that you're learning on the job. That's more what they care about. Like, yes, there's someone like Madie is going to get on the lower end of the patient care for our role, but we have some people in our class that spent 15, 20 years in another career. I was just talking to a class of 2025. He was already a retired firefighter paramedic, but now he's going back to do PA. Like, you're going to get this huge range, but it's not about the number. It's very hard to tell this to pre-PA applicants. Forget about the number. Like once you get over a certain amount, it doesn't matter. It's about what your experience you had. And Madie brought up a great point. When you do something, I don't care about the hours you did it. I care about what you gain from it, because you could spend 5 hours shadowing someone and have the most like transformational moment of your life. And that's way better than a year you spent doing something else. So like, it's way more important to like keep track of what were the most impactful things to you, because that's what's going to get you into a school in an interview. That's what they're going to care about on the CASPA application. Okay. So just don't focus on the number. I know it's going to be hard. You're going to look at every site and it's going to be like, this is how you be a competitive applicant, whatever. Focus on what you're going to be more valued in, because that is how I made my PA program. Was they saw value in my journey, my weird journey that I had, and then they saw that I could bring something to the classroom of students that they had. It wasn't about the number; it was about me as a person.
Mm-hmm. Yeah, can I add one thing too? I like that he said, it's not just about the number, because there's a lot of other things you can do with your time too once you reach that amount of hours. Like you can volunteer, you can do research. There are just so many other ways you can be competitive as well. Because I think in maybe the area that I was weak in patient care hours, I did research. I just did other things that could kind of help elevate that application, or just have a really fire personal statement, just finding ways to kind of set yourself apart. Like Ryan was saying, it's not just, oh, Ryan had this many hours, he's a shoo-in. It's like, no, what came of those hours.
So. No, I think it's really good to zoom out on the experience, because it's so easy to like Ryan mentioned and like Madie mentioned, like both of you mentioned, that to zoom in and be like, oh, I need to hit this threshold and this is all I'm going to be going for, instead of really reflecting on those experiences. And I think the last question, since the time is coming up, wow, we're flying by, is that specifically curiosity about Augsburg. Like, why did both of you choose Augsburg? And tell us a little bit about the good parts of Augsburg.
Perfect. I'll have you go first again, Madie.
All right, sounds good. Why Augsburg? Well, I think the biggest thing that sticks out to me is they practice what they preach, which I think I find really important for me when I go to a school. It's like, oh, some schools will say, I value diversity, I value experience, I value just all the things that make Ryan or Madie. And I think Augsburg really, really embodied this. And you can just see it in who they accept. Like, I think our class is a great example. We have people in all different backgrounds, different ethnicities, different healthcare backgrounds, different just everything. For example, we have, someone who just got their master's in master's in dietetics. And she was 21 when she first started PA school, and she is a very young applicant. And then on the other end of the spectrum, we have a 40-year-old female who was a respiratory therapist for 10, 15 years. And I think she maybe had a different job. So I think just finding a program that really embodies what they say. And I think when you find a program that does that, you'll see that follow through in different areas. Like if they say this is their mission, do they really embody and practice that mission? And then another piece that I liked about Augsburg was just being the longest standing PA school in Minnesota. They have really great connections. So I had some really great core rotations at Regions, at Children's Minneapolis, just at really big hospital systems that I think just will kind of help give you a leg up. Because one thing that I just learned, honestly, this past Friday was, we should list some of our rotations on our resume, which I thought was interesting. I'm like, oh, why would you do that? And it's like, well, there are just so many ways that you can find a connection, and you just get kind of more credibility by training at, these really big sites that, train residents, they train fellows, they train PA students. So I think those were the two things, finding a program that practices what they preach, and finding a program that has been or for me, I think finding a program that was established and kind of had these kind of deep roots within the Minneapolis Twin Cities area. But I don't want it. That's not me saying you shouldn't do, a new program that's just starting, because there are strengths in that too. What do you think, Ryan?
Yeah, no, you hit a lot of the big points. First of all, every program has their strengths. But everything that we say about Augsburg doesn't mean that you won't find something equally as valuable in any other program. But obviously, we chose it for a specific reason, and they chose us, and that's a really cool thing for us to have. But for me personally, my brother actually graduated his undergrad from Augsburg, and he was on the spectrum for autism. He had ADHD that was crippling, and we didn't ever think he'd graduate from college, even go to college. And he was treated so wonderfully at Augsburg through his program that my whole family just had a deep respect for Augsburg as a result of thanking them for kind of changing his life. So there's a big component of that there. But then the other component is, I had a weird journey. I had a really weird journey into medicine, and I really wanted a program that valued my strengths, values things that I had that were different than the typical student. And Augsburg has this deep commitment to helping the underserved, and really they care about the sociology of medicine. And I had part of my degree was in sociology. I wanted to be able to take the privilege that I had in my life and give and support people that didn't. It was a passion of mine, and I could see that flowing through the Augsburg faculty. That was a mission of theirs, and it was just inspiring to be amongst those people. And then the third thing is, in the interview, it was confirmed before I even had the interview, but in the interview, like talking to the faculty, I'm like, these people are exactly like me. They want to know me. They value me. They even my story matters to them, and they think that I can bring something to this classroom. And I just felt, for someone who for a long time didn't feel that way, I had a weird journey. I had a whole cycle where I wasn't accepted at all. And to have a program think that way about me was like, almost to this day, it means so much to me. So it was kind of those three reasons together were just like, Augsburg was always my top school. It's kind of the dream school, was always the plan, but it's cool to actually be here and be able to talk about it in that way. But like I said, every program has their strengths. The biggest thing we push on Vitally Stable on my podcast is reminding you all to apply to programs that you actually want to be a part of, that will turn you into the adult and professional that you've always wanted to be. So don't just choose a program off rank. Don't choose it off statistics and whatever. Choose it because you like the people that you're going to be working with, because those are going to be your future colleagues. And you want to know that you're like honored to be a part of that alumni and a part of that history of that organization. So that is how you should be looking at it. But me and Madie found that because we were really open about what we wanted. So make sure you are open and adamant about what you want when you're looking at programs.
Awesome.
Yeah, making a list, is
Mhm.
really great just to start. Yeah. When you're looking at
Awesome.
programs.
Well, I think thank you so much for giving us really valuable insight. That wraps up our session. Thank you again, Madie and Ryan, for spending your Sunday with us and sharing insights about PA. I hope you guys can keep an open mind and keep PA as an option in your head. And next up we have our closing remarks. So please make your way there, and Alexia will be announcing the giveaway winner and wrapping up officially our 5th annual pre-health conference. So thank